Hello again and welcome to This is Public Health. I'm Pamela Kirkland with the West Central Health District, and today we're going to be talking about a new program that has recently started in the Columbus Health Department, and it's going to help quite a few people and change a lot of lives. Joining me today to talk about the PrEP clinic at the Columbus Health Department is Stephen Chambers, who is the HIV Prevention Coordinator for the West Central Health District. Welcome, Stephen.
Thank you.
And also Joey Gosa, who is the nurse practitioner in charge of the clinic. Welcome, Joey. Thank you for coming.
Thank you.
So we're going to start with you, Stephen. So tell us what PrEP is, first of all, and how PrEP works.
Okay, first of all, PrEP is pre-exposure prophylaxis.
Okay.
It is a medication given to people who are HIV negative in an effort to help keep them HIV negative.
Mm-hmm. Now, when you say medication, what do you mean by that? Is it an injection or once a month pill? How does it work?
It's a once a day pill. It's Truvada is the brand name.
Okay.
It's taken once a day. And what the pill does, the pill primarily blocks the body's ability to allow the HIV virus to attach to the cells, thereby keeping the person HIV negative.
Okay, so who primarily is this for? Is this like for anybody who's HIV negative, or are there just different people that may benefit from that?
Okay, based on guidelines by the CDC, persons who are HIV negative who are in a relationship with a person who's HIV positive, they would benefit by taking this pill to give them that extra protection. Anyone who's HIV negative who is in a relationship and they're not sure if that relationship is totally monogamous, they would benefit from it. Primary target groups are men who sleep with men. Right now we're looking at an increased risk we see in black women and Hispanic women, but anyone who is sexually active, who is having sex that may be unprotected, anyone who's participating in IV drug use.
Okay.
Those groups are the primary groups of people that we look at, which when you look at the population, everyone is a candidate for PrEP.
Right, right. So now I know a lot of people like to compare our HIV rates with Atlanta and things like that, but what are our rates like? Not specific numbers, but how is Georgia faring as far as HIV rates and infection and transmission? Would it be called transmission, not infection?
Okay, when we look at the nation as a whole, in 2017, according to the CDC, Georgia ranked 5th in HIV population. However, we ranked 1st in new diagnosis.
Oh, that's not good.
It's not good, but the initiative in ending the virus, ending all HIV cases by 2030,
right.
PrEP plays a very important role in that, in keeping people who are HIV negative. Taking that pill once a day will help them remain HIV negative.
Is this something that's new? How long has this medication been around?
PrEP has been on the market since 2012.
Okay, that's quite a long time.
It was primarily aimed at the MSM population. And for people who don't know, that's men who sleep with men.
Okay.
Primarily aimed at that population. But over the years and the spread of HIV across all demographics, we see it as a method that can protect everyone.
Do you think that people have become more relaxed about their habits as far as their sexual relationships go? It seems like when HIV first came up and AIDS was really big, everybody was super concerned about it, and that condom use was really high, and everybody just kind of took steps to make sure that they did not become infected. And then it seemed like, well, to me anyway, that people just got really relaxed about it.
I'm not sure if I would say the word is relaxed. I think with the advent of technology, technology has really increased the way people connect.
Right.
As far as dating 30, 40 years ago, it was a face-to-face meeting. Now you can text someone on your phone, you can go to chat groups, Facebook.
Right. A lot of social media.
So many sites that we can connect. So that has taken a lot of it out. And I think sex is as sex has always been, it's always been there. Now,
Right.
with technology, we can just connect a little more.
Yeah, a little easier. Before we go to the break, though, and get into the PrEP clinic and what's all involved, tell us what are some of the other ways that people can reduce their risk of becoming HIV positive? What are some of the things that maybe people have forgotten about that they need to remember?
Okay, good. Well, the number one deterrent that we always say, condom usage. Condom usage is not 100% effective. However, it's right there like 99.9% effective against most sexually transmitted infections and diseases.
Right.
PrEP usage along with condom usage pretty much guarantees you that you will not catch HIV.
Okay.
Abstinence. The number one thing is abstinence. If you don't engage in it, you have thereby reduced your chances of catching something to zero.
Right.
So we always say abstinence, condoms, and now PrEP.
And right, it's not just HIV, it's all sexually transmitted diseases.
Everything else. We look at gonorrhea, chlamydia, syphilis. Those things are transferred through bodily fluids. So thereby, condoms can help the spread of those.
Okay.
And there are some STDs, STIs that they're skin-to-skin contact. So, condoms and the PrEP definitely works for
And
HIV.
then, like for people who are in high-risk groups, like people who use drugs, sharing needles, isn't that a big way that HIV is transmitted?
Yep, sharing needles with IV drug users. We do cleansing of needles. As we know, Georgia is currently advocating for a clean needle program. We will
Right.
see how that goes with legislation. But using clean needles, cleaning your old needles, if you are an IV drug user, definitely that can also impact your chances.
Oh, great. Very important things for people to remember.
Yes.
All right, Stephen. Well, when we come back, we are going to talk with Joey Gosa, who's the nurse practitioner in charge of the PrEP clinic at the Columbus Health Department, so stay with us.
I am a teenager.
I am online.
I enjoy sharing thoughts.
Music. Videos.
Ideas.
Information.
I will not
I will not be a victim to threats.
to stalking, to soliciting, to predators.
I will be responsible.
I will be careful.
I will be honest.
I will be smarter. I will get my parents involved.
I will protect myself.
I will be safe.
I am a teenager.
And I
And I
Will not.
be bullied.
I present to you Algebra 2, Foreign Languages, and finally, Biology. Who among you will step up to their challenge?
Me.
Yeah, I'll do it. Me too. Sign me up.
Take on the tough classes now. You need them to prepare for college.
Welcome back, everyone. Right now, we are going to continue our conversation about the PrEP clinic that has recently started at the Columbus Health Department. And joining me right now is Joey Gosa, who is the nurse practitioner who is in charge of the PrEP clinic at the Columbus Health Department. Welcome.
Thank you.
How are you today?
Good.
All right, so when somebody comes into the health department and they want to go to the PrEP clinic, what's something that happens? What's the first thing that happens?
Initially, a person can come into the clinic and decide they just want to have an HIV test. If they have an HIV test, they obviously think there's some risk. So
Okay.
we would offer them PrEP at that point.
All right.
They could also come in and just basically ask to come into the PrEP clinic. And at that point, they could enter it there. Once they do that, they will be registered into the health department with just their demographics, their address, things like that.
Okay.
Once they're registered, we make sure first that they have an HIV test, and it has to be negative. In order to get on to PrEP, they have
Okay.
to have a negative HIV test.
Okay.
Once they do that, they meet with me, and I'll counsel them on if this is something they really want to do, because there's a commitment. There's a commitment to come in and be tested every 3 months, and they have to go through a screening and testing, and they have to maintain a negative HIV status.
So this is really a maintenance medication. It's something that they
Absolutely.
have to take every day, right?
Absolutely.
So they do have a big commitment to do that. I know
Yes.
it's hard for a lot of people, though. I mean, to take regular medication every day. A lot of people forget. I forget. I forget all kinds of things. So I know it's probably hard to to go and make that commitment and basically kind of do what they really need to do to stay healthy.
Right. So they have to sign an agreement
Oh, okay.
that they will come in every 3 months because we don't want to start it and them not completely committed because
Right.
the efficacy of the drug goes down with every dose they miss.
Okay, so we talked a little bit about people that might be candidates for PrEP. What are there other types of people that might be candidates, that would benefit from this medication?
Basically, it's any client that comes in who is has drug use, IV drug use, or is in a relationship that they feel like that they're not completely sure that their patient is or is not HIV
That
negative.
their partner is not
Their partner.
HIV positive. Okay. I guess that could, like Stephen said, could pretty much be anybody,
Almost.
So what kind of testing is required? You said that they need to be tested for HIV before they get on the medication, right?
Right.
So how often did you say that? Is every 3 months they're tested for
Every
HIV?
3 months.
Okay.
Right.
And what other kind of testing is required if they're on this medication? Is there any?
Yes, we do initial test for, we do a complete metabolic panel, and we do that to check their kidneys and their liver function because basically the
Okay.
Truvada is metabolized through the kidneys, so we want to make sure they have good kidney function. We also want to make sure that their hepatitis screenings are negative, because if you have hepatitis B, even though Truvada is a drug that we use for hepatitis B, we want to make sure that we're aware of that. And then we also want, if a patient comes in, we want to make sure that a female comes in, we want to make sure that she's not pregnant because we don't treat pregnant patients.
Okay. So like the kidney function and all those tests would be done before the patient gets on the medication. And then the HIV testing is done every 3 months?
Yes, and we also check the
Okay.
kidneys every 3 months.
And the kidneys are checked every 3 months. So is the hepatitis testing, is that done also every 3 months? Or is it just done at the initial onset?
We just
at the
do
first
that
visit?
at the first visit.
Okay. Now, what kind of follow-up does the health department give to these patients? Besides coming back and getting tested, are there like referrals to any other kinds of programs or things like that?
We bring them back in 1 month to make sure that they're tolerating the medication, that their kidneys are tolerating
Right.
the medication well. And then after that first initial, and to make sure they are not acutely infected with HIV. So we'll do a little screening to make sure that they don't have fever, lymph nodes, flu symptoms that might indicate an active HIV infection, recent. And then we will also check them for pregnancy. But we'll do that initially. And then every 3 months, if they meet that, every 3 months, then we'll check them again.
Okay. So it is quite a lot that's involved with this, not just coming in and getting the medication or getting the prescription and then going home.
It's very quick, though. Yes, it's a lot, but it's just a test,
Right.
a few questions, and
So when a patient comes in, are they able to get that prescription for the medication that same day?
no, we have to make sure the tests come back and that they're okay.
Okay, so it's
Once
like,
the tests come back and they're okay, then we call a pharmacy company and we have it mailed to their home, or we can have it mailed to the clinic, whatever their preference is.
okay, so they don't go to a pharmacy to get it?
No,
They would either come to the health
it
department?
goes in a very discreet brown paper bag.
Oh, okay, so they either come to the health department to get the medication or it's mailed to their home?
Yes.
Oh, okay, that's great. All right, so what about insurance? Does insurance cover PrEP? And what about people who may not have insurance?
We assess them for insurance and we see if they do have insurance and we do apply for it. However, that is not a deterrent. We
Okay.
have programs that we can put the patient on that for no cost to the patient at all.
Oh, that's really great. Very important to know for anybody out there who's thinking that they may be a candidate for PrEP, to know that they don't have to worry about the cost. All right, thank you, Joey, for coming on today and talking to us about the PrEP clinic. When we come back, we're going to talk about some other programs that the health department has for people living with HIV.
Man, I wish the city would fix these darn potholes. Someone needs to report this.
Has this ever happened to you and you didn't know who to call? It's simple. Dial 311 or 706-653-4000. Columbus 311 Citizen Service Center. Our goal is to provide complete, accurate, and timely information to citizens and employees regarding complaints, inquiries, and requests for information. Columbus 311 Citizen Service Center, your direct link to city service.
Welcome back to This is Public Health. Stephen Chambers is joining us again, and he's going to talk to us about some of the programs that the health department has for people who have HIV and the kind of support that they get. So what can you tell us, Stephen?
Well, first of all, first program is the prevention program. We always talk about prevention. We offer free HIV testing every day. You come up, you ring the bell, someone will come get you, you test. The entire testing process takes right now about 12 minutes. So we always advocate everyone should know their status, come up, get tested. It's a very positive environment, and you leave with your results in hand.
Okay.
That's very important when we talk about the PrEP clinic, because you've got to have a negative test result to be seen by the PrEP clinic.
Right.
For individuals who are already HIV positive, who may not be in care or may have fallen out of care, we have our Ryan White program, our Ryan White Clinic. The Ryan White Clinic is open every day, Monday through Friday, 8 o'clock until 4.
Okay.
Come up, excuse me. You come into the clinic, they will take your information, and the process starts there.
Okay. Excuse me, but so if somebody comes in and they get their HIV test and they find out that they're positive, can they go ahead and start the process right then and there, or would they need to come back, or how does that work?
In our office, that process begins right there with the positive diagnosis.
Okay.
When a person is tested positive, we begin to link them to the services that they need so that they can get medication, become virally suppressed. That is when your viral load is less than 40 copies. At that point, you are undetectable.
Okay.
And the current slogan, undetectable equals untransmittable. And that is the goal for all HIV patients, is to be undetectable.
Okay, so if they are positive, the medication that would be available to them helps reduce that viral load.
Yes, ma'am.
To keep it undetectable, so that they would not be able to transmit the virus to someone else.
True.
Correct? Okay, so go back, sorry about that, go back to the Ryan White program. So that is part of the Ryan White program?
Yes, ma'am.
Okay.
The Ryan White Clinic is for patients who are HIV positive. And those patients are seen there. They are screened for financial
Guidelines?
Yeah. For the financial guidelines, and all of that has happened through the clinic.
Okay.
The clinic's number is 706-321-6411.
Okay.
Again, that number is 706-321-6411. We have some community partners that we work with who refer patients to us, and that is private providers in the area. We partner with the Columbus Wellness Center. Their focus is on women and youth.
Okay.
And I don't have that number, I do apologize, but it is the Columbus Wellness Center. You can Google it. We love Google.
Oh yeah, we love
Everything
Google.
works through Google. The Deborah Smith Wellness Center focuses primarily on anyone with HIV, primarily gay men.
Okay.
And that number again, that website again, the Deborah Smith Wellness Center.
Okay.
And we have a new partner, Grace Outreach Community Center.
Okay.
New to our community, they offer services and HIV testing as well.
Okay. So when someone is HIV positive, how important is their family support and their support system of their family and their loved ones? And do you work with these patients on like how to talk to their families about their positive diagnosis?
Yes, as with all medical conditions, having a great support system is always wonderful. In many cases, people have wonderful support systems, but there are those times when there is no support system outside of the medical care. And what we do in our office is we have a behavioral health counselor to work with that patient. We have our linkage to care. We have our public health educators to work with those patients to discuss their diagnosis and to look at all possible ways that they can mitigate any factors that may prevent them from getting to their medication and then being very adherent to that regimen.
Right.
Because medication adherence is the number one factor in maintaining their HIV diagnosis.
So with the PrEP medication and also the medication that they take if they are HIV positive, are both of those, well, the PrEP is a daily medication. What about the other medications? Are those daily? I've heard a few things about something that's like once a month or every 2 months or something like that.
Yes, the HIV medicine can be once a day, but it depending on the type of virus that a person have, they could
Okay.
go up to something that twice a day, or it could be 2 to 3 times a day.
Okay, all right.
But it is a daily medication
So
as
it's
well.
daily, and that's what's the important part, because if they skip a day or they forget, and it's very important for them to take that every day as prescribed.
Yes.
Okay. So what, you mentioned linkage to care. What is the linkage to care program?
Linkage to care is the process that is used in the state of Georgia whereby any individual who is HIV positive, linkage to care is used to help that patient access medical care. It begins with the Partner Services Division, which will contact all partners of the person who is newly diagnosed or previously diagnosed and offer them free STD testing. Because the number one way to prevent the spread of disease is to treat it.
Right.
You can't treat it unless you get tested. So we offer testing to all the partners. A person who's HIV positive is then works with linkage to care to get connected to medical care, thereby getting connected to medication.
Right.
Linkage to care also works to get that person connected with other supportive services such as food, clothing. If there is a need for substance abuse counseling or behavioral health services, linkage to care is that spot that helps that person access all those other services.
And you mentioned food. Nutrition's a big thing
Definitely.
for patients, isn't it?
Yes.
I mean, how does that, I mean, they're counseled to like really make healthy choices as far as their nutrition goes, correct?
That's true. And the patients who come to the Ryan White Clinic, there is a nutritionist on staff who counsels them as to which foods work well with medications, which foods they should not partake in so much. And I mean, I'm not a dietitian, so I'm going to
Yes.
kind of,
Okay.
again, direct it over to the nurse practitioner.
Yeah, there's also, absolutely, there are some medication, some foods that you would not want to take with our medications.
Right, yeah.
And also there's some foods that if you were, had a high viral load that you wouldn't want to take because it might cause an opportunistic infection. So, yeah,
Okay.
there's foods that, but the dietitian is very good at counseling them and letting them know what medications they need to take,
That sounds great.
what foods they need to take.
So, Stephen, how long have you been working with this program?
This program, December 1st will be 5 years.
Okay, so in your 5 years, I remember when HIV first came up and the reaction that everybody had, and just in your 5 years that you've been with this program, how have you seen things change?
I will preface this comment by saying my first interaction with HIV patients was in the hospital back in 1988.
Okay.
At that point, most people who were given an AIDS diagnosis at that point, they were living approximately 3 to 6 weeks. So to see what has happened in the 80s, to see it now where someone comes in, the process is laid out, it is a step to step, it is walking in this door to the next door to the next door to get connected to medication. And we see there are patients that have been living with HIV for 30 years.
Oh my gosh.
I
That's
mean,
amazing, the transition
It-
from where it was to where it is now.
It's
That's
wonderful.
incredible. Yeah.
It is wonderful to come to work every day and meet someone who can say, okay, I'm newly diagnosed, and you can, with almost 100% certainty, say, you will be okay. We can connect you from your positive test today to medication in a short period, and can see that person come back in 3 months and see the progress where the medication is working, where that viral load is steadily being reduced, and that person is living with optimal health. That's wonderful.
That is a big, big step.
Great.
Absolutely. Well, when we come back, we're going to give you some contact information about where you can call and get more information on HIV and the programs that the Columbus Health Department offers. We'll be right back.
I volunteer.
Step up. I volunteer.
I volunteer.
We volunteer.
And I volunteer.
Hi, I'm Sally Goins, the volunteer coordinator here at Columbus Animal Care and Control, and we would love to have you come and help make a difference. If you're interested in volunteering, please call me at 706-225-4666 or email me at animalcontrol@columbusga.org.
Thank you for staying with us on This is Public Health. I just want to thank my guest today, Stephen Chambers, who is the HIV Prevention Coordinator for the West Central Health District.
Thank you.
Thanks so much for coming. And also Joey Gosa, who is the epidemiologist at the West Central Health District, who also is in charge of our new PrEP clinic. Thank you, Joey, for coming and explaining to us how that works for the patients.
Thank you.
If you'd like more information on the HIV programs that we have at the health department in our district, please go to columbushealth.com and you can find more information there. Or Stephen, what is the phone number for the DCS services?
We'll do 706-321-6300 and ask for either HIV prevention or HIV care.
Great. Thank you so much for joining us today. We'll be back with another edition of This is Public Health. I'm Pamela Kirkland. Have a good day.